Good afternoon, Pascack Valley community. Welcome to another session of Ask the Doctor. My name is Dr. Thomas John. I'm an orthopedic surgeon specializing in hip and knee replacement surgery. I work out of Summit Health Orthopedics. We're used to be called Active Orthopedics. We're the same group, just a different banner. So I'd like to reintroduce myself in that manner. We're right down the street here at Old Hook Road. And I perform my surgery right here at Hackensack University Medical Center at Pascack Valley Hospital. So it's my honor and privilege to join you guys for another exciting Tuesday afternoon. We're going to be talking about some very common concepts, nothing strange. It's a very informal opportunity, so please use your Facebook session to type in any questions you may have. We have some preset questions I'm going to help answer. We're going to delve into osteoporosis today, talk about some differences between that and another similar sounding word called osteoarthritis. And it's important to understand the differences, the similarities, and what you can do about them. Okay? So without further ado, I'm going to hand this off to Shannon, who's going to ask me questions, and I'll help answer. Right, so we'll get started with the first question, and that is, what's the difference between osteoarthritis and osteoporosis? Is there a connection? First of all, let's break up these words. Osteo, that root suggests bone. Arthritis, again, you can break that up further. Arthro refers to the joint. Itis means inflammation. So osteoarthritis refers to joint inflammatory condition where cartilage breaks down. You get resulting inflammatory condition and pain and swelling. Osteoporosis, again, the same root word, osteo, so it has to do with the bone. But porosis has to do with breaking down of the bone. So what's the difference? Is there a true connection between the two? No. However, it tends to happen later on in life. So in that sense, it does happen to the same age group. So osteoporosis, it's important to know that our bones, as we go on in life, it's a race. There are cells called osteoblasts that make bone and osteoclasts that break down bone. And so when we are younger, the two of them are equal. So they make and break at the same time, so that's fine. As you get older in life, so typically over the age of 50, it tends to affect women more. The osteoclasts tend to win, so the bone is broken down faster than bone is being laid down. So you have a mismatch, and then you end up with weaker bone. And that's a condition where the bone becomes more fragile. Why does it matter? Well, it's not about joint pain or knee pain. It has more to do with, God forbid, you slip and shop right and you fall down. What are the chances you might break your wrist or your hip? That is the difference between the two conditions. Right, so that's, again, a very deep and loaded conversation. We can spend all day talking about it. But very simply put, again, now you guys know the difference between osteoarthritis and osteoporosis. So osteoarthritis, the most common kind is called primary osteoarthritis. There are also other conditions called rheumatoid arthritis or psoriatic arthritis. Regular osteoarthritis tends to occur because of wear and tear. It could be multifactorial, meaning multiple reasons. Genetics, does it run in the family? What did you used to do for a living in your younger days? Did you used to stand up a lot, heavy-duty labor? Did you play sports as a kid? Did you beat up those joints? Did you have trauma? Did you break your kneecap? Did you break your elbow or your hip? That plays a difference. Are you a little bit more heavy set? Every pound you are overweight can break down your joints a little bit faster. So it's a multiple reasons that can cause osteoarthritis. Osteoporosis, on the other hand, is a different condition. Now, that too can happen just because. There are certain factors that put you at a higher risk. Being a woman puts you at a higher risk. Being Caucasian, African American, Asian American puts you at a higher risk. Being over 50, if you're too thin, if you actually happen to live in the northern hemisphere like most of us do, poor sun exposure. So there are a lot of reasons why you can get osteoporosis, or you can have that mismatch where the bone is broken down faster than it's being made. Other reasons that it can also happen if you use a lot of steroids for other reasons. Let's say you've had asthma. Certain medications can break down bone faster than it is being laid down. So there are multiple reasons why you can get osteoporosis and osteoarthritis. So the question was, what happens when you get arthritis? So the most common symptoms are pain. And let's pick a joint, for example. Let's pick the knee. It's a weight-bearing joint, so when you walk on it, it's going to hurt. So pain is the primary symptom. Second can be deformity. Let's say you've always had straight knees. Well, as the joint breaks down and the cartilage is gone, now the knee can bow. So if you get bow legs, or conversely knock knee, and you didn't have as bad of a problem as a kid, that's another symptom. Sometimes it can swell, so it's called, some people call it water in the knee, or effusion. It's the same thing. The body makes extra fluid. It can be a little bit warm to touch, and certainly it can be stiff, and those are the most common symptoms of arthritis. Right, so osteoporosis is a little bit more tricky. Now, pain can occur. Generally, it's a much more silent issue, meaning you don't really know if you have osteoporosis. But let's say you get older and you find yourself stooping more, right? So you're leaning forward, your classic picture of an older person kind of hunched over. Well, what's happening is the bone is so weak that the spine, which you can imagine are a bunch of blocks stacked up, they're actually fracturing, or they're getting squished. And before you know it, they become a bunch of wedges, and the spine is now curved and you're hunched over. So that's a classic sign. Or as you get older, you find a sharp pain in your back. That is a classic sign. You should get it checked out. They could be what we call compression fractures in the spine. Other symptoms are you haven't done much. You just went for a long walk, and now your doctor said, listen, you broke your toe, or you broke a bone in your foot. And you're scratching your head like, why did that happen? I didn't do anything, and how am I getting a fracture? So those are other symptoms. Otherwise, obvious symptoms would be if you break your bone with a very low impact. When normally the idea is from standing, a healthy person with a healthy bone should not break stuff if they fall from standing. But if you're breaking your hip or your wrist from standing, it's generally a suggestion you may have osteoporosis. Right, the question is, so what do I do? How do I manage it? Well, step one, we have to get an objective test to see if you even have it. So one of the ways to do that is to get what we call a bone density scan. And basically, to oversimplify it, it's essentially a few x-rays that you do in a very specific way. You take x-rays of your wrist, for example, your hip, your lower back, and then you compare it to a young person, usually someone, they have a standard, and that standard is a 25-year-old healthy person. And they compare your bone to that person's bone, and they say, well, how does it compare? And they have an average, and they'll say, well, if it's less than 2.5 standard deviations, now this is getting a little technical, but the fact is, if it's so far away from that healthy 25-year-old bone that it's very weak, then they'll say it's either osteopenia, meaning it's somewhat weak, or it's very weak, what we call osteoporosis. Now, if you've been diagnosed formally with osteoporosis, then your physician, usually it's done through your primary care doctor, rheumatologist, or endocrinologist. And certainly as an orthopedist, we can help facilitate that conversation. Then you would go on medicine. So I encourage everyone listening, whether you're young, old, especially women after puberty, you should start right away, is be on a calcium and vitamin D. But once you've been diagnosed with osteoporosis, you will go on certain medicines. Now, you want to reverse that mismatch. Remember, if you pay attention in the beginning, you want to reverse that mismatch where the cells breaking down bone is now catching up to the cells that are making up bone. So there are medicines that can help switch that. There are other shots that you can get once a year. There are injections that you can help to stimulate bone growth. So there are a lot of different techniques that you can do to manage it. Other things are exercise. Every day, get out and walk. Weight-bearing exercise, the bone actually responds to stress and actually builds up more. So simple things like walking, very important. Other things, get low weights and just go to town at home. Use a couple of 5-pound dumbbells across your legs. A bicycle with some resistance is very important. So these simple exercises, sun exposure, again, within normal reason, right? Too much can be a problem, but a good amount of sun exposure actually helps stimulate bone growth. So these are all some simple things you can do to help manage osteoporosis. Right, so to continue that conversation, it goes without saying you should be on a calcium vitamin D complex. It's a good supplement. You get this over the counter. A general rule is about 1,000 milligrams of calcium, and they call it international units for vitamin D, about 800 to 1,000 IUs of vitamin D. And these are all prepackaged, so you don't have to write it down or remember. It's on your CVS or Walgreens or ShopRite, any of your vitamin aisles. I would pick up a good supplement, take it daily. Good sun exposure, good milk or dairy intake if you can tolerate it, or if you're intolerant, certainly other alternatives. But you want a good calcium intake. And generally, as with any other health conditions, you want a good, wide, balanced nutrition, not too much in one way or the other. Yeah, like I mentioned earlier, arthritis pain is very unique. It's usually, again, around the joints, right? So your elbow hurts, your hip hurts, your groin hurts, your knee hurts. And it's a more ongoing issue. It's like a bad toothache that doesn't go away. It has swelling around the joints. So the joints are the important part. Whereas osteoporosis-related pain is more sudden. It's sharp. You were fine, and all of a sudden it came out of nowhere. And it makes it very difficult for you to function. And those are a little bit different from each other, whereas the latter, you want to get an x-ray and make sure you didn't break anything. Right, so how do we treat this, right? So as an orthopedist, arthritis, I just saw someone an hour ago who said they were going to join this call. Certainly injections are a huge part of how we treat this. And again, our goal is not to prevent the joint deterioration, but to help manage pain and improve function. So to that end, there are injections we do in the office. There's steroid injections, lubricating gel injections, more experimental things like platelet-rich plasma and stem cell, although the research does not back its routine use and insurance doesn't cover it. Physical therapy is very important. When the muscles that span the joint is strong, it takes the load away from a deteriorating joint. So you can still walk, go to the grocery store, take long walks, and the joint doesn't bother you. And obviously at the end is when a surgeon like myself comes into play, and we talk about replacing it. The silly analogy I use in the office all the time, think of a worn out joint like a flat tire. So when the tire goes flat, you don't put creams on it, you replace it. So when it gets to the point where it's very difficult to function, we replace the joint. So I do knee replacements, hip replacements, we do minimally invasive surgery, rapid recovery, so you get home the same day or the next day. And here at Pascack Valley, we've been doing a fair amount and excellent results. Now, osteoporosis, the treatments are what I mentioned earlier. A, diagnose the right condition. B, go on appropriate medicines. And it's a discussion to be had either with your primary care, rheumatologist, or endocrinologist. And it's usually a medical treatment, not a surgical treatment, unless, God forbid, let's say you break your hip. Then you would need something like a rod and screws or something more involved like a partial hip replacement. But that's fortunately far and few in between. Not everybody with osteoporosis needs those operations. So we have some questions coming in. I encourage more for those listening at home. So Shannon's going to read off some questions. I didn't catch that first part. Yeah, so the question is, what are the continued treatment options? So the fact is, so let's say the medical treatments that I mentioned before, right? So you got diagnosed and you're told, listen, you got some weak bone. So generally, most commonly, your doctor may put you on pills by mouth. And what that does, it slows down the cells that are breaking down the bone, so the cells that are making bone can catch up. Well, you don't want to take it too long because then it can go the opposite way where the bone actually gets too brittle. So generally what happens, you go on it for 2 to 5 years, you take a break, you take a repeat test to see how your bone fares. You want to make sure you're actually responding to the treatment. And let's say you get a repeat bone density scan after a couple of years and it's showing, wow, Daisy last time was severely osteoporotic, but today she's actually in the osteopenic group. You know what? That's an improvement. Then you continue with that treatment. And so generally the rule of thumb is if it works, keep at it because it actually has a benefit. Because remember, the goal here for osteoporosis is to prevent you from breaking and need someone like me in your life. So I think you do whatever you can that works and you keep it going. You want to get in a good exercise program, whether it's in your local community, whether it's formal physical therapy. You want to keep your muscles strong, good diet, keep your weight in check. Yeah, that's a more of a anecdotal comment, right? So does warmer weather help? I'll tell you, listening to my patients, especially the winter birds, they fly down to Florida, the joints feel much better. And that has to do with the fact that the joint is covered by what we call synovial fluid. It's fluid that's meant to be a natural lubrication. Unfortunately, during the winter time, that fluidity, or what we call viscosity, or how liquidy is that substance, it tends to be a little bit more thick. And so you can imagine if your joint is already rubbing against each other, and now your natural fluid is more thick, it makes that joint more tight. Whereas in a warmer weather, it tends to be more viscous or more fluid-like. And so it tends to move more easily. And so that, in my opinion, tends to be the correlation between warmer and colder weather. And also warmer weather in general improves blood flow, circulation, and keeps those muscles nice and nimble. Generally, anecdotally, that's what I find. Whether there's hard data to support that fact, the jury's still out. But you ask anybody with arthritis, and they'll unequivocally answer yes to that question. Yeah, so the question is Pilates a good exercise? I think it's an excellent exercise, especially as our society gets back into the gym and formal workouts. It's a relatively low impact exercise. It keeps your muscles nice and strong. Obviously, you have to listen to your body. Don't put your joints in any position that may exacerbate your symptoms. So certainly it's something you want to discuss with your instructor if you have one. So I think we're at the end of our questions. I hope I helped answer some of your questions as it pertains to osteoporosis and arthritis. Certainly, if you have any other questions, please feel free to chime in and type them away. Otherwise, it's been awesome to be able to connect with the community and talk to you more about this.